Hello learners, welcome to this session. Today in this session, we will be talking about environmental quality and human health. This session is part of the course MEV 018, that is Environmental Health and Ecotoxicology of MSc Environmental Sciences program. So learners, let us see how does environmental conditions affect our health, what are the dimensions and determinants of human health, and how do they get influenced by the external and internal environmental conditions. Learners, first of all, let us understand what do we mean by environmental quality. What does it contain, what does it comprise of, and how does it get affected? If we go into the definition, environmental quality is a set of properties and characteristics of the environment. Now, these characteristics may be either generalized or local as they impinge on human beings and other organisms. So, when we look into the details of this definition, which contains so many parts, a part of it says that it is a set of properties. It is a set of characteristics, and these characteristics vary from region to region. These characteristics are dependent upon various physical, chemical and meteorological factors, and most importantly, they may be generalized or local. So when we just simply discuss about environmental quality, that means it is a set of conditions. These conditions change over time, scale, pace and also region. What has been noticed in the times to come that environmental quality has been under the influence of various physical, chemical processes which take place in the environment. More often so, these natural changes which have been occurring for a very long time have today been influenced by the anthropogenic factors. And the reason because of which we say that environmental quality is showing a sea change. The environmental quality is not like as it was before. So when we explore the environmental quality, whether it is at a macro level or micro level, we must also ascertain that it has a direct implication on communities, on individuals, and apart from it, various other species which are present in those conditions. So when we say environmental quality, we may also infer that it is just a condition of the environment. These are the conditions of the environment having the characteristics of physical, chemical and biological elements and has a different impact on different species which are inhabiting that particular region or a particular habitat. Why it is interesting and what do we conclude by this is that, and therefore environmental quality may be favorable or unfavorable, that becomes a quite relative phenomena. Because for the bacteria which can thrive at a very high temperatures, yes, the low temperatures may be unfavorable conditions for them, and likewise those species which inhabited the cold environments, they may not find it suitable to survive in the regions which are characterized by high temperatures. So therefore, what is the common notion about environmental quality is that it can be a good quality environment or it can be a bad quality environment, that is totally dependent upon the characteristics of the living organisms, our adaptability, and how far we are successful in living according to the changed environmental conditions. Further, another aspect of this session is human health. So what we have understood by environmental quality is the conditions which are influencing us. But then what is human health? Most simple definition which has been given by WHO, that was long back in 1948, and what has been clearly marked here is that health or good health is not absence of diseases. And this we must understand that health is a state of complete physical, mental and social well-being, and not merely the absence of disease and infirmity. And in the recent years, there has been an addition to this statement where it has been said that also a healthy condition or a healthy individual will be the one who is able to lead a socially and economically productive life. Now, where we find individuals which are in a complete state of physical, mental and social well-being. Now this has much to do with the external environmental conditions, and this is what we are going to study in today's session, that how the environmental conditions comprising of the various factors, how do they influence human health. Learners, we do not want any evidence. There is no dearth of evidence actually to support this statement if we say that our health, our individual health and also the community health is affected by the quality of the environment, is influenced by the quality of the environmental factors under which we are living. What are these factors, what are these dimensions and how do they affect us is well known. We know how the diseases are grappling. We know that how that we are exposed to chemicals because of pollution and other things, and how far they have been affecting our health. This has also been understood. What is required today is that how we can protect ourselves and how we can catch hold of those environmental conditions which are affecting the global health of individuals. So, further going, what are the dimensions of the health? Because when we say it is a state of complete social mental well-being, but then there are certain factors which determine. Most commonly speaking, we say that it is the physical and the mental dimensions of the health of an individual. So, physical dimensions comprises of the most basic physical requirements of an individual which pertain to good quality food, water, air that we are breathing, the amount, the type of housing that we have. These are the physical elements. So, the air which we are breathing, the water which we drink, the place where we live, these are all the physical elements which determine our health. They adversely affect our health when we say that the air is impure and we are exposed to contaminated water, when we are exposed to toxic harmful chemicals by way of when they enter into our body through various routes, or the type of the crowded communities or the crowded houses or the damp houses which are which have scanty sunlight, we can say, or which are not airy. So these are the physical dimensions of the health. Now they also disproportionately affect the individuals. At one end, the individuals which may be, for example, elderly people, the asthmatics people, the children, they are more exposed and they are more vulnerable to a certain set of environmental conditions, and therefore we find that a certain set of individuals become more ill in such conditions. Most of the focus of our health programs and most of our state of being healthy is directed towards ensuring that we have physical determinants in place, where we find that yes, we must have, the individuals must have access to good food and the quality of air and water. And we know the state of the affairs today, where millions of the people who are living in a water deprived conditions. But apart from it, what is gaining recognition and importance nowadays is the mental dimension of the health. More so, it is the state of balanced state of mind, and it also relates to our social, our mental and our emotional well-being. So we have two classes in a society where a section of the people are falling ill, or you can say they are not healthy because of the physical determinants missing. But more so, we also find in today's society that yes, there are certain sections of the people who, because of the mental related, emotional related issues, we may say that they are not healthy. So, for a person to be healthy, the physical and the mental dimensions must be in place. Now, what comes next to our mind is that how does environment come into this picture? How do we see and how do we may take the case where environmental factors are influencing the physical and the mental health, and of course we may it may sound convincing that yes, the environmental factors may have a implication on the physical dimensions, where of course the food quality, air quality, water quality, that impacts the health of an individual. But this is also established fact that environmental factors also influence the mental well-being of a person. So let us explore this more, where we are finding that environment and health are closely related. And I must say, there is no dearth of evidence to support this statement, because we very well know how the diseases are coming, how we are becoming more and more vulnerable to a range of bacteria and viruses, to chemicals, and so on and so forth. They are related, and good environment is an indication of good health of an individual's, wherein we find that where the standards of air quality and water quality are in place, we find that the individuals are healthy than their counterparts. And we have lot of examples which we have seen during the pandemic, that the cases of mortality has been higher in the regions where the air is polluted, or where the immunity of the people is low because of several persistent health related problems occurring. What has now happened today is that it is of a serious concern that pollution and anthropogenic factors are adding and becoming the cause of worry, because of which we may say that we are becoming, we are exposed to different types of chemicals, different types of pollutants which are there into our environment. So, environment and health are related, and we must also know that what are the environmental determinants of health. Although our health is physical and mental well-being, but there are certain environmental determinants. Now, what are these? Broadly, they are classified into physical, chemical, biological, and social environmental determinants. Now, physical environmental determinant is, for example, we know physical entities, for example, heat, light, temperature, humidity, spacing, housing. So these are the physical elements, and they also influence the health of the people. Now, we know that because of climate change related factors, why we are so much worried about the climate change phenomena, why the research is on where we are studying the impact of climate change on human health. Because increase in temperature, rise in temperature has an influence on the climatic parameters, and these parameters may be related to high temperatures happening at certain places, droughts and famines becoming more recurrent, or natural disasters occurring. These are the physical dimensions which not only affect the health of the people, especially the elderly and the infants, but also have an influence on other living conditions. And another thing is that the physical, chemical, social factors what we are dealing with, they do not occur in isolation. Basically, they are interrelated. So, there may be a case where a chemical which is entering into the ecosystem may lead to change in the physical attributes of the ecosystem. And different organisms, different individuals have different varying levels of, you can say, tolerance for different chemicals and different physical chemical factors. So, in view of this also, this is a case where the determinants of health affect the health of the people in adverse manner. Likewise, the chemical determinants of health. The chemical determinants are the toxins, the chemicals which are which find their way into the ecosystems, the rivers and the soils and the air, because of various anthropogenic activities in which we are indulged in. So these chemicals, and why, their simple example is that why we are seeing increase in the rise of the cancers in the last few years. Why it has become so common? Because of the different types of chemicals which enter into our body for a long period of time by way of food, by way of water, by way of different routes of exposure which are occurring. So this is an example of the chemical environmental determinant of health. These may occur for a short duration in case of any accident happening, where we find a lot of cases where because of any obnoxious gas inhalation, there are cases of respiratory problems occurring. But over a long period of time, these chemicals persistently, when they are there in the ecosystem, they get into our bodies through various routes, inhalation, ingestion and other mechanisms. And because of the other phenomena that we may be discussing in some of the other sessions, biomagnification and bioaccumulation, they are there in our body, and therefore over a long period of time, then we find we ourselves are infected by different diseases. Likewise, classic example of the biological environmental determinants. You must be knowing about the different types of allergens which are there. These allergens cause respiratory problems. They may cause different types of infections to human beings. Then we also know why there is so much of incidence of bacterial diseases happening, viral diseases happening, why the strains of the virus and bacteria are becoming more severe than ever before. Because of these, they are the biological factors which have entered into our ecosystems and in our nearby environments. Then there are social environmental determinants. Now, not only our health is influenced by the environmental factors, but the social level, the illiteracy, the status of the public health programs, the level of awareness, the disease control mechanism. So there are different, the income level of the people, the literacy of the people, the status of women in the society. Now these are some of the social factors which influence the community health and the individual health, which must be more researched, and which we must invest on the social factors also to see that healthy individuals are being brought. So these are some of the common factors which influence. Now, when you further explore the physical, chemical, biological and the social factors over a period of time, then we notice that because of anthropogenic factors and because of so many types of artificial elements, the four factors which you just saw on the screen, they are altered. They are becoming more severe. There are new entrants in these different heads, and these are posing health threats to the people. So within during the course of time, what we say that the life expectancy has increased. People are living longer, but we are not so sure about the quality of the life of the people. So because of different medical interventions, because of so many types of treatment possibles, the innovations which have been done, we are able to conquer many of the diseases and we are living longer. But still, the quality of the life has been affected, that has been compromised because of n number of factors which are responsible for it. So these are some of the simple examples which you can see on the screen. We are very well aware of these facts, that how climate change is, all the environmental problems or things which are going on in present are posing threat to the environment. So simple phenomena like water pollution, climate change, population increase, biodiversity loss, waste generation, all these you will find that has an implication on the health of the people, whether it is the individual health, community health, global health. Because urban growth is taking place, ecosystems have been damaged, there has been increase in the level of the greenhouse gases, the soil properties, the water properties have changed. We know that how water stressed we are at present and what is the state of the affairs which is predicted for the years to come. We know the state of the food which we are eating. We know that there are chemicals there in the food is adulterated, and there is entirely a different topic of discussion where we can go on discussing that how the food which we are eating is impure, contaminated, and how it is life-threatening in the years to come. So, therefore, there is a term called environmental burden of diseases, and you must know when you talk about environmental quality and human health, the EBD concept, that is the environmental burden of disease, which was earlier introduced first of all by the World Health Organization, and it gives us an idea that what are the risk factors in the environment and in what way do these factors influence the health of the population in a comprehensive and comparable way. And it also on a broad level it explains the proportion of ill health attributed because of the exposure to bad environmental factors. So in the last few decades it has been seen that the environmental burden of diseases is increasing. If we go on explaining this in a very small and very simple concept, is that the diseases which are outbreaking and which are happening to the population, there is an environmental burden to it. And when we say environmental burden to it, that means it is because of the changed environmental conditions which have taken place. There may be change in the air quality, water quality, soil quality, the type of food which we are eating, as we discussed, the type of housing in which we live in. That is the environmental burden of the diseases. And therefore, there are terms like quality adjusted life years. You must know, learners, about this thing, this concept, that what is disability adjusted life years and what is quality adjusted life year. So quality adjusted life year simply explains that how, because of the improvements in the environmental conditions, what addition has been there in the, what value addition, I must say, in the quality and quantity of the disease which has been lived. So, good health is also important for economic growth. This is very important for us to understand, that it is not just an individual loss, the number of sick days which a person has, but overall if we calculate, it has an economic consequence, it has an economic repercussion. So quality adjusted life years means if we invest towards improvement in the environmental conditions, if we invest towards improving the health status of the people, that good quality, how much it is reflected in the economic growth of an individuals. And likewise, there is a term called disability adjusted life year. And disability adjusted life year means we are prone to diseases. There is a, for example, there is a disability. The number of days in a month when we fall sick, how much loss does it occur overall on the economic growth of a country and also on the productivity of an individual. So this is very obvious that if we fall sick too often, if there is a kind of a disease, if there is a kind of an accident, or if there is a premature death because of environment related factors, then it explains that how much of the number of years that has been wasted. Now this also was developed in 1990s, and it is a way of comparing how do we compare the health and expectancy across the countries, across the world. And learners, we must also remember one thing, that we have talked at length about the factors which are there in the external environment, but indoor environmental quality also has a big role in health of the individual. So In today's session, we have seen that what is environmental quality, what does it mean, and how it relates to health of the people. Thank you so much.